स्वप्निल स्वप्निल
आपण कॉल केलेला आहे सध्या आहे आपण प्रतीक्षा करू शकता किंवा नंतर पुनः प्रयत्न करू शकता आपने जिस व्यक्ति को कॉल किया है वो अभी दूसरे कॉल पर व्यस्त है कृपया प्रतीक्षा करें या कुछ समय पश्चात प्रयास करें The person you have called is speaking to someone else. Or call again later. ज्या व्यक्ती आपण ज्या व्यक्तीस कॉल करीत आहात तो व्यक्ती उत्तर देत नाही कृपया नंतर प्रयत्न करा आप जिस व्यक्ति को कॉल कर रही हैं
Hi, good evening. How are you? Can you hear me? Can you
Yes.
hear me?
Yes, we can hear you.
Sanjeev, can you hear me? You need to unmute yourself.
No, not muted. Still, you can't hear me? We can hear you, sir. We can hear you. Hear me? Yes.
Yes.
So, Mr. Joy, something you
Yeah,
have
yeah, I
to
can
do.
hear you. I can hear you.
Okay. So the challenge is Dr. Ajay Kumar is not able to join, and I'm not able to get through to Swapnil. His phone is busy. What do we do?
Okay, I'll call him. Swapnil, you are not taking call from Mr. Sanjeev.
If we can call up Dr. Ajay directly, that would be great.
Yes, we are speaking to Dr. Ajay Kumar only.
Okay, okay, good. I saw
Hi, how
Vishal.
are you?
Hi, Joy. How are you doing? Good to
I'm
see you.
fine, I'm fine. How are you?
All well, Joy.
There's some nice way of zooming in, zooming out, Vishal. How are you
I don't
doing
know
it?
this stuff on my computer keeps on doing this. Yeah,
Good, good. कुछ होता है इसमें ऐसे तो zoom okay.
there is this adaptation called Logitech which just keeps on making you move.
You don't need something to make you move. You need something to stop you from
And
moving.
sometimes it takes me out from there. Yeah.
So you have to be nice to him, huh?
Correct.
So again, a busy day, Vishal. Today also, back to back.
Yeah, Sanjeev. It's a pretty long day these days.
I know. So I keep telling everybody we all spending a lot more hours, but is the outcome lot more?
Productivity,
No.
yeah, productivity of the number of hours, right?
Yes, productivity in terms of input is definitely high, but outcome, we don't know.
Yeah, it's. I think a lot of this tech-enabled Zoom calling also is not really beyond a point. It is not the greatest of outcomes, right?
Yeah, like, but what to do? This is the best you can do given the situation.
Yeah.
Hi,
Hi, oh,
hi,
Dr. Ajay is there. Hi, Dr. Ajay. Good afternoon,
hi,
sir.
hi, Vishal. Hi,
Hi,
Sanjeev.
Doc. Good afternoon. Good to see you, Doc.
Nice seeing you. It's been a long time.
Yes, Doc.
How are you?
All well, Doc.
Good, good.
So I think it is already time has come. I think we can start.
Good. So, Mr. Santosh Mishra is still not there, right?
So he's not picking my call, sir. I'm trying to call him. I spoke to his colleague or his office also. He said he'll check with him. In the meanwhile, we can start with.
I can see Dr. Ajay is having some nice coffee.
Yeah, sorry, we can't have wine, no?
That filter coffee is good enough, Doc.
But Vishal, to have that, you'll have to go across to Mysore. Dr. Ajay is in Mysore camping there these days.
Oh, you're not here in Bangalore, Doctor. You're in Mysore.
I have been in Mysore only doing my work, and my whole team is telling that I'm a lot more efficient on the Teams call rather than so
No, Dr. Ajay, what I have heard from many a times in similar situation is the team says that they are more efficient because the boss is away.
no, whatever, as long as it's working, that's what matters.
Correct, I agree with you. So, Mr. Joy, should we start?
I think we should start.
Okay, so you are the opening batsman. So you please go ahead. You don't need introduction. I don't have to introduce you to anybody. So all I can tell everybody is that, yeah, you are the CII chairman of the task force for healthcare. And you are not just the man who is behind the show, he's also in front of the show. And all the CII initiatives and healthcare initiatives are led by you. We are really grateful to have you around. And you are also the Chief Operating Officer of PD Hinduja Hospital. That's all from me. And all to you, Mr. Joy. Please go ahead.
Thank
To
you,
introduce
Mr.
others also or no?
No, when the thing panel starts, that time you can.
Okay.
Introduce.
Okay.
So, good evening and thanks, Mr. Sanjeev, and taking this leadership panel discussion forward. And I could see that you have great personalities, and the topic is very important. That how getting into research and converting into reality. So, on behalf of CII, I want to welcome all of you, and I want to tell you that in month of September 24th onwards, we had a 4 days conference and 14 days digital exhibition. What is going on, which will be over on day after tomorrow. And during this, we had close to, I don't know exact number of registrations so far, but I know last it was around 2,500 people registered for this event, and it started from 5th of September, and this is the seventh leadership panel what we have, and we have couple of more, and with that we'll be completing on 9th of October. So during this 4 days conference, we had people from across the globe, and we had several people from international arena. We had Netherlands to be the country partner, UK as a partner. We had innovators from Israel, and most of them showcased the kind of innovation they have done in technology part of it, and the entire program was branded as Hospital Tech 2020. And it is my privilege to have the industry academia luminaries present today in the afternoon, and we are going to hear about the India story. I know that all of you have done a lot of work, and you have ensured these innovations are coming into the real practical arena, and it is getting implemented. And I'll be more than happy to hear today some more stories related to that. And with this, I want to thank Mr. Sanjeev and all the panelists for joining here today. And I hand over to Mr. Sanjeev to take this interesting discussion forward. You are mute, Mr. Sanjeev.
So somebody from the system, somebody may have done it. All right. So can you hear me all? Yeah.
Yes, yes.
Okay. So, first of all, let me introduce the other panelists. To start with, Dr. Ajay Kumar. He absolutely needs no introduction. So I don't have to spend too much time. But only one thing which I wanted to share with everybody, which people may not know about him, that besides being, having come from MD Anderson, being a healthcare entrepreneur, being a practitioner, he's all and a visionary. He's also a marathon runner, and that's something which which he had shared with me once when we met, and he says, "I just passed your house in the morning when I was taking my run." So, and we know, and we all know, healthcare is not for sprinters. It is for marathon runners, and I think we are very fortunate to have a person like Dr. Ajay Kumar, doing his uh, big bit in changing the healthcare scenario in India. So thank you, Dr. Ajay Kumar, for being here, and good to reconnect with you after a long time.
Thanks, Sanjeev. Thanks for having me.
Now, next, of course, is Vishal. I can call him Vishal because we've known each other for long. Otherwise, he is known as Mr. Vishal Bali for very good reasons. Just to go back, I have known him for more than 20 years when he was running operations at Wockhardt at the Cunningham Road. And from there onwards, I have seen his journey moving into Fortis, leading Fortis India, then Fortis Global, and then moving into this new role of TPG and private equity. So Vishal, fondly, I'd always tell him and keep pulling his leg. I call him the poster boy of healthcare. He is. There cannot be a big event without him being there and he being right in the middle of all the action, and his pictures all over. So thank you, Vishal, for being here. I know it isn't easy to pull you in, and I know I almost harassed you to get you here, but I know it must be for good reasons. I hope you understand. Yeah.
Yeah, no, thank you very much, Sanjeev. It's a pleasure to be here, and it's always a delight to hear from you and to talk to you, and also to have this panel with Dr. Ajay Kumar and everybody else. So thank you for having me on the panel.
Thanks. Next, I wanted to talk about Dr. Sujay Kar. I don't see him on the screen now. Is he there, Dr. Sujay? Dr. Sujay, can you hear?
Yeah, I'm here. I can hear you.
We don't see you. Why have you, people unmute themselves? You switched off your video, is it?
No, I'm seen and heard.
Okay, I'm not seeing you. If others are seeing you, then it's fine. So let's go ahead anyway. So, Dr. Sujay, again, I've known him for a very long time. He's one guy from the medical fraternity whom I see more or equally active outside the medical fraternity in terms of academia and interactions with corporate. And some of you may be knowing that he's also a hugely focused guy on quality. And you may also be surprised that, he's a Six Sigma, I think black belt, if I'm not mistaken, which is the highest level you can have in quality. I am personally a green belt, and I know how difficult it was to get green belt. And if he's a black belt, hats off to him. So he has the quality focus, he has the corporate interactions, he has the academia, and he spent a lot of time in MIT, Sloan Management School. He's adjunct faculty of IIT Kharagpur as well as IIT IIT Calcutta. So I think we couldn't have had a better person than him on the panel, who can represent academia and can also represent the healthcare providers space. So thank you so much, Dr. Sujay, for being here.
Thank you, Mr. Sanjeev, for the kind words. Thank you. Really appreciate.
And finally, we have Mr. Prashant here. I have not met him before. We did speak. Dr. Sujay was the one who connected me with him. I have seen his biodata or CV, whatever we call it. It's just mind-boggling. I think he has anything and everything on paper, starting from gold medals from the governors and going forward to degrees from any and every top institution in the world. So thank you so much. And of course, he's now in Microsoft, and there are a dozen and more technologies, which are making an impact in the world. But in my own little judgment, I think AI and cloud are on top of it, and he represents both of them. He's heading the program as the program director for Azure as well as AI initiatives in Microsoft. Thank you so much, Mr. Prashant, for being here with us.
Thank you, Mr. Sanjeev, for having me on the panel.
And I just forgot to mention, he's also on the visiting faculty for ISB or Triple IT in Hyderabad, isn't it?
Faculty at Indian School of Business.
In the School of ISB. So we have a lot of academia, corporate, healthcare, and money bags in Vishal Bali, private equity here. So I think really feel privileged that, I am being, we have all of them together at this forum together. So as far as I'm concerned, I'm Sanjeev. I worked with Siemens and GE for about 30 years and then started my own little startup called MedDev Technologies. We are in the space of healthcare, teleradiology and PACS. And I've done my BE Electronics from University of Science and MBA from Faculty of Management Studies, Delhi. So with that, is Mr. Joy still here? And is there any news? Swapnil, are you hearing? Is there any news from Mr. Santosh Mishra?
Yeah,
yeah, he's there.
Sorry for the delay.
You're there, sir. Good. So very happy to have you here, Mr. Santosh. You happen to be now in this list of introductions last, but yeah, you're obviously not the least. I had a little bit of interaction with Mr. Santosh Mishra a couple of weeks back in another panel discussion organized by CII, Connect 2020. He is amazing, I must tell you. He's amazing. He's an IIT Kanpur person. He's also MS from University of Minnesota. And then in services, I have a lot of my friends from my school and college days who are in services, and I know what it takes to make it to that league. I'm really proud of having a person like you, Mr. Santosh Mishra, in the bureaucracy. And I also know that you are not a healthcare man, but again, I think you have everything else and maybe some flavor of healthcare, which we would like to listen to you, and we would be happy if you can share with us. Thank you so much for being here, Mr. Santosh Mishra.
Thank you so much.
So now, Swapnil, Mr. Joy, anybody to guide me, or shall we start?
So you may start. So I was just speaking with Mr. Misra. He has also joined. So you can
Who is
take the
joined?
discussion forward. Mr. Misra, I was just speaking.
Yeah. So I've introduced him also to the panel.
Yeah.
Okay.
So you can start the panel discussion. And
Okay. So once again, thank you everybody for being here. And this topic, research to reality, I must tell you, while it's close to my heart, and I'm really passionate about it. But the trigger for this panel and discussion actually came when Vishal and I were talking a couple of weeks back. So while I was talking of the academia, and the other end I was talking about scaling of it. So that's where he came in, and he's the man who scales it all. But coming back to the subject, see, my own take on this subject is, and I sincerely hope I'm wrong. So having spent a significant time in Institute of Science in Bangalore, and having been in touch with the faculty there, despite having, or even after having come out, my feeling is that, these institutions, and with due respect to all of them, and ISC is no exception, I think do a tremendous job of training students, teaching them, bringing them up, and writing papers, publishing papers, getting PhDs, and I think they do a fantastic job of that. But after that, all that effort, just going fast forward quickly to the end game, end point where the patients come in, and I'm just taking an arbitrary number, if 100 papers are published, probably one or less really goes on to make an impact on the society and patient care in general. This is my assumption. I have tried to Google it and get some numbers there, not successful, but I have shared these numbers with the faculty at Institute of Science, and they tend to agree with me, and they do feel that somewhere there are publications which have also captured the same fact. So the objective of this discussion and this platform was to see where the drop-off is happening. If some 100 plus scientific papers are being published, why only one or less goes on to making an impact? And where does the fall off happen? And just to quickly put the stages as I see it, from pure research to academic research to corporate research to the industry and to healthcare providers, hospitals, within hospital CIOs, and then clinicians, and finally taking it across and scaling it up to the society at large. I don't know where does the drop off happen. My feeling is that bulk of it happens at the starting point itself, at the institutional level itself. But I leave it at this point of time for all of you to discuss it. Let's think through it and see if at the end of this 1.5 hours and half an hour is 20 minutes already gone, if we can have some ideas and thoughts as to what are the 2-3 things which we should be doing to increase this conversion rate, which as of now looks pretty dismissive. So this is my hypothesis. Maybe I'm right, maybe I'm wrong. I'm open for this to be challenged by everybody on the panel. And I know all of you are much better equipped to comment on this and put some worthwhile thoughts than I am. So I will leave it to all of you to discuss it. In between, I will see whatever as a moderator I'm supposed to do. But that's it. And while I do want to go to Dr. Ajay Kumar first, but just as a housekeeping, Mr. Santosh Mishra, you told me last time we were having a conversation that you have your board meeting with the CM also clashing with this event. Where
Yes.
are we with that now?
So now, if I can let off at 5 sharp, I'll be okay.
Okay, all right. So we will go through Dr. Ajay Kumar first, then Mr. Santosh Mishra, Mr. Vishal Bali, and Mr. Dr. Sujay Kumar and Sujay Kar and Mr. Prashant Gupta in that sequence. First round. After that, I'm sure we will obviously want Mr. Santosh Mishra to say whatever he wants to say before he has to leave. Yeah. So Dr. Ajay Kumar, over to you, sir.
Dr. Ajay, you're on mute.
What is the time span each of us have, Sanjeev?
Sir, you have maximum time. Okay, I can tell you that you will not be limited with the time. Yes. Because with due respect to everybody, I know you can contribute the most, and I would not let that opportunity go.
Thanks, Sanjeev. And to begin with, I think it's a great idea because for us as practicing oncologists, and we consider science background, even though I'm an entrepreneur. What made me really come back to India of 28 years is when I looked at the great gap in India between what is clinical material we have and where we are with the research and my own experience at MD Anderson everywhere. One of the striking things is, the compartmentalization what we see in India in the terms of research. We have a mindset that research academia is done in the universities, non-profit hospital areas, whereas all the private enterprise is commercial. And they are not interested in research, and there is no collaboration between the researchers and the private enterprise. Even in early 2000, when we moved back to India, that was one of the striking things. And what I saw in US develop over 28 years was there is intense collaboration. MD Anderson is private, but collaboration between NCH, National Cancer Institute, and development of either modalities of treatment or drugs is done in a together way. And we encourage a private enterprise. What we see today in Silicon Valley, Lot of it is with Stanford working together. It is a symbiotic relationship which makes it happen. Even though research papers are published and the failure rates are high, and drug companies work with private enterprise, with academia to create this model. But the thing about India is it is maybe because of the bureaucratic setup and the way it is looked upon. You are looked upon when you are a private enterprise, you looked upon with jaundiced eyes. And the people look upon you as though you are there to make money, boats loads of money. That is the first impression. What is your return you're making? Why should I collaborate with you and research? Why should Tata Indian Institute of Science collaborate with you? You know what? Okay, give us some specimen, but we don't want to really create something out of it. That is the essence we get, not to be negative or anything, because we have brilliant minds, Sanjeev, brilliant minds. The same people are working in India, go there in Palo Alto, and they have patents and researchers, and they run major companies. They have worked with academia in all the time. There is a doctor, I had a call a few days back, who has created so many patents and so many innovation, but he is on a faculty of a major university. So this kind of relationship is not there because of the way the vertical setup has happened, unfortunately. Even to get a grant from DBT or others, people will not give if you are a not-for-profit. You have to be a not-for-profit organization. This stigma that if you're a private, you will not. Whereas look at the way private enterprise is thriving, working together. So the model has to be where, academia works hand in hand with the private institution and the government supports. But look at the support we get from government, zero. I should say negative, actually, not even zero, because the government puts you down for doing research. So, it is very unfortunate that this is not looked upon. And today the most unfortunate thing is, I'll give you one example. At a meeting where the one famous doctor from MD Anderson was giving a talk on head and neck in Delhi. And one of our doctors says, what do you think of this protocol? What should we do? He said, he just said one word. You are the area of head and neck. You are the head and neck capital of the world. Number of head and neck. You should be the one teaching me, man, not me teaching you. Okay. And we invited him to talk about head and neck. It is so despicable and shameful as a nation to face this kind of comments. And the guy who was invited for breast cancer to talk about Asian breast cancer was an American from Houston. And he said, why are you inviting me? You are to do your research. So the shameful thing is we have become followers. And we have, become followers. Whenever we come up in the meeting, Sanjeev, where we say, let us do this protocol or that protocol, the first thing happens, but usually from a government hospital is, where is the evidence? He raises his hands. Where is the evidence for it? I tell him, man, we create evidence. Evidence is a moving target. We have to create. Let us work together. No, I want to see something written in US, something from Harvard, something from John Hopkins, then only I will follow. And we have become slaves to that. I'm sorry, I'm very open. We have become slaves to that and forgotten being in India, there is a research element. We go to US and we all are researchers. When I was in MD Anderson, I did various phase 1, phase 2 trials. But where are we able to do? We can't do those trials here because there are so many impediments for the trials. So all I want to say in the few minutes is there is a phenomenal opportunity to research. People talk about bench to bedside. I talk about bedside to bench. When we talk about genomics, we learn from patients. When I see a cancer patient fail on treatment, I want to know why they have failed. And most of the data is coming from Caucasians. We are following. There is ample evidence to say that Indian genomics is different. And we have written projects. Can you support us? We will do Indian genomics. No, because there is no interest. Neither the government nor the industry doesn't want to support. Because when you look at industry, when you look at your own GEs and other industries, they are all quarter to quarter performers. You know that. What is my EBITDA quarter? What is my profit? Where is resource money? Neither is. I have spoken to pharma companies. Can you allocate some money for research? No. There is no research. We are good in copycatting the drugs which others make it. Why should we make our own drugs? Why should we spend money for research? Because we can easily copycat. If somebody has an immunotherapy, man, I'll copycat and give it to you at a much cheaper price. Why should I be in the forefront? So, the brilliant minds are there. And brilliant minds, when I saw the Nobel Prize for black hole, Chandrasekhar was the pioneer. He got Nobel Prize in US for black holes. Because we have brilliant minds, but we are not able to put to use because the ecosystem is not provided. So research to reality in India particularly is not happening because the ecosystem like Silicon Valley, we have not created. Even Bangalore, which is considered good, it is not there. In private enterprise for healthcare, particularly, I'm talking about, there is really not enough grants or money or anything being given. Whatever research we do as HCG, plasmapheresis for COVID, or cytokine therapy we have done, but we are still waiting for approval because there is so much of push and pull. Oh, this is a private enterprise doing. How can I approve? That is the first thing which ICMR said. Private enterprise doing. How can I approve? If the government does, okay, maybe that. So these are kind of the limitations for our brains to expand. We want to do, and we go abroad, we find, my God, this is seven. That is why most of our talent moves away. They go there once and they don't want to. So what we have to look at in this kind of conference, how do we influence the bureaucrats? The bureaucrats are I'll tell you, the bureaucrats, the so-called IAS officers are the ones who are not coming and saying, let us do work on this, because they have a mindset government. There are some exceptions. Obviously, there are exceptions to all of this. There is no doubt. But majority are inbred that government should be the one. The government should run the entire machinery. So, look at private care. 75% of private care is done by healthcare in India is done by private. Where is the recognition we are getting? Zero recognition we get. So all I am saying is research to reality. Today we have so much of clinical material, so much of new drugs, new innovations, our own, Ayurvedic drugs, all the things are today used. Taxol was an Ayurveda drug, which has been exploited by Bristol Myers, billions of dollars. We could have done it. Why didn't we do? Growing in the sub-Himalayan region, plants. We are not able to exploit what we have in our own self because of these limitations of private, non-private, profit, non-profit. So where is profit? Without profit, tell me, Sanjay, you think Roche would have been there? Will Roche or other company, Pfizer, will they go and invest new drugs if there is no profit? Is it all philanthropy? Can it all be philanthropy and altruism? There is no altruism. So what I have coined the word is capitalism is important. You have to be certain what is good for my company or do. But at the same time, selfishness and selflessness both have to come together. What can I do to the society? How can I make a change? How can I do this? A combination, I call it capo altruism. When you combine the two, it's the best of all. So India has to migrate towards the capo altruism. We have to decide what we have done in HCG today in oncology, where we have revolutionized care. People said you can't go to, Vijayawada, Vizag and take care of treatment. Angol, we have done it. We have transformed, not only in terms of care for research. What is the right treatment to give? How do you give? That can happen only if these two elements come together. Private equity is very important. Without private equity, I don't think HCG would have been there where we are today. And research has to be part of that component. The private equity cannot look at only 25% IRR. Can I contribute some for research? That is what we are doing and successfully done. Our academia, essentially now there are no barriers. To summarize my say, there are no barriers between private, academic, research. All are one. When I take care of a cancer patient, I have to look at what is the right treatment, what is the research, what is the academia. All have to be combined together to give the team. I have to be academic institution, research institution, and caregiver. There cannot be only one. So there is no difference. I'm a university, I'm a research center, I'm a foundation. All of those days are gone, Sanjeev. Today, it is all one. And what is the right treatment for this particular patient at this time? I can't wait 10 years. What I'm doing research today cannot wait because the patient is not going to be alive for 10 years. I have to do what is today. What is the protocol so I can save that patient? My own son, I'll stop with it. My own son has Duchenne muscular dystrophy, very debilitating disease. He was not supposed to live beyond 15 years. There's no treatment. I went to all the universities abroad, funded for fellowship. Even now, today, that is going on research. No treatment. But A private enterprise got into it, and 2 weeks back they got FDA approval. It may not be applicable for new cases with Duchenne today. There is a treatment because the private enterprise got into it, even though it is an unusual disease. So these are classic examples. Minimum is 17 to 18 years you have to wait for something to develop in research. So classic examples are there, the studies are there. So I only request that at least in Indian scenario, brilliant minds, capable, we are capable of winning Nobel Prize all the time. How many, we don't know. But we need to be provided that ecosystem where a combination of private, government, non-profit, everybody can come together and create that kind of a platform to take our research to a different level in healthcare. And immense opportunities are there, Sanjeev. Immense opportunity.
Thank you so much. If you had said anything else or with any less passion, I would have been surprised. Knowing you, it's coming straight from the heart and from the mind.
Because I've been through the mill, Sanjay, been through the mill. I
Yes.
see the frustration on our part, how it is.
I'm happy you shared it here in a platform which is open to public. I don't know how many people are watching and listening, and I'm sure even if there are those who are not watching and listening, the recording will go across, and I'm sure they will all be able to hear you loud and clear. While this is a cricketing season in some sense, IPL, and I would have normally said you are an opening batsman, but given the context that we have Mr. Santosh Mishra coming after you, who is bureaucracy, who is who is the commissioner for e-governance, and who all this I'm sure I have briefly touched with
one
him.
thing about bureaucracy is there are good people. Once they start putting their mind in, they get transferred.
Correct.
And somebody else who's managing Metro becomes a secretary. And say he teaches us what to do health.
No, so why I'm saying it is, so now I will put you as an opening bowler and him being the batsman. Let's see how does he handle whatever you have said in general and specific reference to whatever you have said about bureaucracy. So Mr. Santosh Mishra, over to you.
Thank you, Sanjeev ji. I think, first of all, grateful to have been here. Thank you for inviting me. It is really good to see Mr. Dr. Ajay Kumar. I presume he's a doctor, right?
Yes.
So Dr. Ajay Kumar speaking, and I think you have said it, Dr. Ajay Kumar. You have hit it right at the head. This is what you have said is so pertinent, and in fact, what I was about to say is in the same vein, maybe slightly more theme-based, if you will. I have one of the areas where I really wanted to contribute and serve was health. Unfortunately, for last 20 years, I have been never, other than my district collectorship, I have never had any interaction with the health system. And this is a system in this country which is in dire need of reform. And, I come from Uttar Pradesh, very populous state. And the horror stories I see in my village, in my town, and the place I live is just, devastating. The kind of healthcare people get, and of course, I mean, it is it has become so expensive, needlessly expensive, deliberately made expensive. And of course, the information asymmetry always ensures that you are subject to exploitation if you, unless you are really someone who understands. And forget about it. I mean, it's impossible for us to understand. I mean, I'm fairly educated, but still I find understanding the diseases and their causes and interactions very difficult to comprehend. So if you look at the health statistics, we are short almost by, I think, we need almost twice as many doctors in the country as we have. We have, on an average, I was seeing the OPD statistics somewhere I was reading, on an average, a doctor gets to spend about 25 seconds per patient. It's worse when the hospital or the health center is a rural hinterland, Uttar Pradesh community health center or some such place. And this actually puts a serious question mark as the whether we are able to, and of course, I mean, all these things are essentially directly linked to your GDP growth rate, your productivity, and they are, I mean, the health and education. I mean, it's no brainer. I think health, education, and infrastructure, these three things, if you can put that right, you are on the path to development. And I think that is what is missing. And I think infrastructure, I think I would say that we have really managed to start delivering on that all over the country, and it's pretty heartwarming to see that. Education, we have moved, from the time where we had not all children in school, 30% in school, then 50%, then whatever. Now it is almost 105% enrollment at primary level, 110% in fact. Plus GER at secondary education is also very high. So education is there, but then the quality and all those aspects come in. Same thing with health. I think we started with having people having access to primary health care and secondary health care. And I think the government over the years has built up that infrastructure that everybody or every village will have at least within 2 kilometer radius a PHC or something. Whether they deliver quality stuff or not is a big question mark. And to that extent, what we really need to do is, and in fact, that's why I'm very excited about this present assignment which I have, where actually you can start using these technologies, AI and data analytics, to actually come up with solution which fills these gaps, whether it is the doctor to patient ratio gap or whether it is specialist availability gap, because I mean all the doctors are then concentrated in cities. They are not available in the rural areas. And I think then the cities, if you have 1:2 ratio on an average, in rural areas, it's 1:5. I mean, you need to increase almost 5 times. So what happens, and I think coming back to, I think this was what I always believed. And then coming back to the topic, what happens to the research and why we are not, I completely agree with what Dr. Ajay Kumar had to say. I think we are still are infected with this white man superiority complex. We think that what happens in the West is a great thing, and I think medical is one area where actually it makes very clear sense to have our own system. I mean, everybody's composition is different, and you've been seeing this. I mean, what should be the normal sugar level? They start looking at the Western, Caucasian male and decide about that. Their lifestyle and their food habits and their climate is so totally different from ours. We consume more salt, we may consume more spices, we may be consuming more, I don't know what, sugar. We have a tradition of eating something particularly on a particular season in a particular manner. They don't have. All they do is just boil some meat and eat. I mean, that's pretty much what is. I mean, if I can speak about, I mean, what is their cuisine? I mean, so this needs to have a very strong reference to the cultural habits, cultural milieu, food habits, general composition of climate in the kind of environment we work, our genomics, whatever, everything is so very different. And I think that's what is required for us to do research, focus on it. And again, as I said, I have always wanted to work in health, but unfortunately I never got an opportunity. And but I have been observing and following very closely what happens in management research, what happens in technology research. And here is what I found, and I think Dr. Ajay will agree with me that some of it will be actually applied to the medical research as well. So first thing which happens, why research doesn't succeed into a social good is because there is a misalignment of objectives. So the researcher's objective is to get published, and get published where? Get published in a journal run by a white country. They have, and this is whether it is about, again, I will not be talking with specific reference to health because, as I said, I have very limited knowledge of that. But I see this in management. I see this in technology. So if you want to publish in a particularly A-rated journal in XYZ country in the West, you need to actually subscribe to the school of thoughts which that particular journal's editor and his or her colleagues have built. If you do not subscribe to that school of thought, if you have a very innovative streak, if you have something which you don't necessarily agree with, that paper is difficult to get through. I mean, as I said, I'm qualifying again. It's not, I have no first-hand experience of health, but I think that is what Dr. Ajay Kumar or Dr. Sanjeev or Dr. Bali has to bear me out with. This happens in management. So if there is a particular way of looking at things, is there a particular way of, and in fact, if you look at the reviews which come back after you submit a paper, and I'm able to say this because I continuously keep writing papers on information systems in some of their very reputed journals abroad. If you see the reviewers comment, it actually nudges you or kind of, compels you to use a certain framework to put your thoughts in. Now, that may not be what you are excited about. I mean, you have done your own research, you have come with your own finding, which is probably much more contextual to India and the state or the place you are working with. But because your objective is to get published, because your publication is important to you, not necessarily you're aligned. So that's what I said, the misalignment of interest. So researcher's interest is to get published because he or she wants a PhD, or whatever is the consequential benefits of it. Whereas what is needed by the society is something which is applicable. As doctor was saying, I mean, if you really want to find, I mean, if something solves, I mean, it reminds me of a incidents when I was a professor at, I was a student at IIT Kanpur, one of the professors. So there was a competition and somebody was asked to design a machine. He designed a machine and then apparently that machine was not very efficient. So this kid, I mean, my colleague or batchmate, he was very disturbed and he thought that, I mean, he is kind of, committing a sin by designing a machine which is below normal efficiency. And he was like, with great hesitation, he approached the professor. He was a mechanical engineering, very senior professor, saying that I have designed this. Unfortunately, it doesn't obey this law. And it totally is not in sync with the efficiency parameters which have been laid down. Now, the answer he gave, and I think it reflects back to what Dr. Ajay Kumar was saying. The answer he gave is, your machine is supposed to help people. It doesn't matter if it obeys laws or if it doesn't obey the law. Is it helping people in making their life easy or not? Is this protocol or this medicine which I have designed or devised or we have decided upon, is it likely to make a positive difference in somebody's life? I think if it does, I think it's worth pursuing it. If it doesn't, then it doesn't matter which law and which protocol it adheres to, it's a waste. So first is misalignment of research objectives are very different. So for a researcher, it is to get the paper published. For society, it is actually something useful. And many a time, and precisely because we have not really come up with our own systems of publication, I think there is a very trying need for India to have, A star and A journals, a huge list of those journals in every field, whether it is engineering or whether it is literature or it is even or medical or whatever it is. Every journal you publish, it is your intellectual property right, which you hypothecate to that journal, and then every time you want to take a print, you have to pay them $30. Or if an institute wants to get access to all the work which you have done, they have to shell out $300 or $500 every year for a subscription. And I think Government of India has actually finally realized this. They are coming up with a proposal saying that all journals will be subscribed by Government of India and made available across the country for every institution to use. Now, obviously, journals will find it difficult to agree to that. Let's see what happens. It's a very interesting proposition. Otherwise, so One is this alignment, misalignment of objectives. Second is, as I was referring to, and I'm so happy Dr. Ajay Kumar was also saying, it's lack of ecosystem. Why our people are able to do so well when they go abroad? Because it's the whole ecosystem. It enables, I mean, things really don't take so long. The processes are conducive and you have resources at your disposal you can pull out. So if you want, how many engineering colleges, for example, again, I come back to engineering because that's where I know a little more. How many engineering colleges will have access to electron microscope even today? None. How many universities in US will have access to electron microscope today? Probably all. So if you have a hypothesis and you want to test it, and night 1 o'clock you got an idea, and if you have a microscope, electron microscope available to you, you can go and test it and come back and experiment with it. Here, if you are in a university where you don't even have that equipment, what do? You write to somebody, it will take you 3 months or maybe a year sometimes. I mean, so really, do you have observatories? I mean, do you have places where you can actually go and do cosmic observations? Do you have powerful enough telescopes to do that? So the question is of ecosystem, infrastructure. The only thing I would slightly disagree with Dr. Ajay Kumar is that while in US government funds a lot of research, in fact, internet is a classic example. It came out of DARPA research grant for communication, need for communication, which is fantastic. In India, I think we will have to devise an alternative to that. I mean, it has to be an alternative, and absolutely right what you said. I completely agree. If you want everybody to be philanthropic, no research will ever happen. I think that we need to really disabuse ourselves from that notion. The problem with the government, when you talk about, and in fact, because Sanjeev ji asked me also to respond to some of what you said. The problem with the government is, and this is a very peculiar problem, and it's actually a difficult problem to solve, because government is not using its own money. When I decide on spending money on a particular project, it's not my own money. It's actually money from Sanjeev ji, from Dr. Ajay Kumar, from Mr. Bali. So as a result, every time I need to spend that money, I have to have a very transparent, auditable system. And that's where it becomes very complicated, because if you approach to me saying, I have a great idea and this is what I have a credential, I've worked in US for 20 years, I'm top-notch oncologist, I'm rated. I mean, there are objective ratings available in the world. 3,000 papers have been quoted. Here is a proposal. Can you give me 5 crore rupees to work on this? And this is going to solve problem for the entire rural Karnataka, for example. I presume you are based in Karnataka, or okay. Can you give me this money? Howsoever well-intentioned I am, I can't, because this is not money which is mine. And I cannot distinguish between you and an individual who may be thoroughly unscrupulous and is a scam running agency. We cannot. And I think what you said is true. Sometimes in government also there is a big distrust of private sector. That has to go away. I mean, that's you cannot have. I mean, you have to have incentive to, and I think slowly that is happening also. If you look at it, this Startup India initiative. One of the way I look at it is basically the way all governments, and including central government and all state governments, are trying to respond, saying that okay, what happens when you want to encourage startups, innovators to actually come up into your system and give them some sort of an opportunity to participate in government procurement or government supply of services. If you look at the GEM portal which has come about, of course, most of the private sector won't know it because they never needed it. But earlier you had the system of DGSMD, Directorate General of Supply and Disposal. So what you want to buy paper now. So what you do is you float a tender in the beginning of the year. Yeah, Mr. Sanjeev.
So no, I had only one point. While I think you have handled a lot of questions of Dr. Ajay Kumar, I know while I was speaking to Mr. Vishal Bali, he also has few points to in reference to government. I was thinking, because you have to go, Can he put
Sure.
those points and you get a chance to react to that also?
Yeah, sure. We'll do that. Yeah.
Yes. So, Mr. Vishal Bali, yeah, I know you had some thoughts on this, particularly a lot of thoughts, but something with reference to the government and bureaucracy also.
Yeah,
So
absolutely.
I thought since Mr. Santosh Mishra is here, we must make sure he hears you loud and clear. Yeah.
No, absolutely, Sanjeev. And so, before I ask Mr. Mishra, obviously, and some of the roadblocks, as Dr. Ajay also spoke about, I think we have to first look at the macro environment, Sanjeev, and which is very critical for us to see. So, India's share of global research and publications related to global research is currently about 5% of the world, right? We are a 1.3 billion population. We are the land of Aryabhatta. We innovated zero, and this is our history, right? And today we are at 5% of the global research of the world. If you take a look at the percentage of GDP spend, and the reason why I'm talking about a couple of these numbers is basically to actually showcase as to countries don't go into an innovation spin and discovery spin just because we talk about it, just because we proclaim ourselves that this is what we will do, say 10 or 20 years from now. I think what we have to really see on the ground is what is really happening in terms of the quantum of research rupee that is actually going into the country. So if you look at the public spending on research and development, which is obviously in the hands of the government, it's about 0.6 to 0.9% of GDP, right? The private spending on GDP or private spending on research on GPD on a percentage of GDP basis is about 0.3%. So look at what is the outlay that we are talking about over here. I was looking at, since Dr. Ajay Kumar also mentioned, clinical research and what have we done in clinical research. So if you take a look at ICMR's, which is the Indian Council for Medical Research, their budgets or their quantum allocation for the last decade, it is in the region of about 600 to 800 crores. What is that compared to the rest of the world? So when we start talking about research, we start talking about innovation, we start talking about that India, has so much to contribute to the world, given India's genetic disposition, given India's disease propensity, given India's research mindset, given the fact that India is the hub of knowledge of the world. It's a different thing that India is today a net consumer of knowledge, whereas in the past, India was a net exporter of knowledge, right? And I think that's a sad situation that we've got ourselves in. So we've got to do a lot more from where we are. I mean, just take a look at, and obviously it reflects, right? Israel spends about 4.2% of its GDP on research. And that's why Israel is one of the most innovative countries around the world. Likewise, Korea, right? And we all talk about South Korea and how South Korea has become so advanced in many of the electronic areas and the research dollar that has gone into telecommunication and everything else, which has come out of the Korean subcontinent. They spend about 3.5 to 4%. So the big question, therefore, for us is that if this country is today sitting on patents, which is just about 1.3% of the whole world, because that's really where we are. We are at 1.3%. Our number of patents that have come out of this country is just about 1.3% of the global patent that is available in the marketplace today. And it just goes to show that this entire process of research to reality, and when you start taking a look at these numbers, means that there is a tremendous amount of focus that needs to happen. We often try and compare ourselves to China, right? We turn around and say, and obviously over the last 1 or 2 months, we've been at this loggerheads with China conversation. If you look at where China was 2 to 3 decades from now, particularly in terms of the amount of capital that went behind the entire research development portion of China, they are now head to head with the number of publications that come out of China to that of the United States. right? So that is where the Chinese have reached in terms of not just publications, but a major portion of that publication has actually gone into commercial production. So, when you start taking a look at, I talked about the 5%, when you take a look at the number of times that our publication actually downloaded for any kind of future citation and references, it is just about 2 to 3%. So compared to, the US studies or the Chinese studies or some of the other studies that are done in Korea and Israel and some of the other countries. So there are miles to go. And so until and unless we actually create, as Mr. Mishra was also saying, and as Dr. Ajay Kumar said, that ultimately it is a question of what is the ecosystem that we want over here, right? Do we want an ecosystem which is progressive, which takes science and moves forward with it? Or we want to be baked into this web of bureaucracy, which does not let anybody to move beyond a certain point because, there are like 100 channels that you need to go through to produce one discovery, right? There are 100 channels that you need to go through even if you want to get into a single research, and then that research to actually become commercial production, and then that commercial production going and becoming important from an Indian perspective, because we are now constantly also having one conversation, and that is about made in India, right? You can't be making in India with a 5% research budget, right? I mean, 5% research output. You can't be making in India with a GDP spend of 0.6 to 0.9%, where the rest of the world, which is actually innovating products and services and technologies, is actually spending 3x of where we are. So I think that's the core here, and that's really the question that I wanted to ask even Mr. Mishra. That at the end of the day, when how is the government and how is the bureaucracy pushing the government to actually delayer these various steps that companies need to go through, that organizations need to, that the roadblocks that are created in front of organizations, that individuals have to cross constantly, where the academia thinks of themselves as a separate vertical altogether. And as we are rightly discussing, that the role of the academia is producing a research paper. The role of the academia has to be not just to produce a research paper. The role of the academia should actually be leading themselves towards creating products and patents, right? And those patents and those products should go into commercial production, because that is truly what India would then benefit from. So I think that's really the question over here, that are we getting ourselves, and is the ecosystem going towards that path where we will actually become a massive innovation hub? We can take pride in the fact that we are a massive innovation hub in technology, but even there, many of the technology patents that have come and have come from outside of this country. They are researched in the United States, right? And then they, through those routes, have come into the R&D centers in India. So, if we really want our R&D ecosystem to do well, if we want our R&D system to actually produce products that India consumes, then if India has to become a factory for the world and use its scientific capabilities, which it has a huge depth of, then we have to cross many of these hurdles. And we have to basically sit on one side and not on the opposite side. And that one side is sit along with the government, sit along with the bureaucracy, create an environment of trust and faith, which will eventually lead us from the path of discovery, reality, to production. And I think till the time we don't do that, I don't really think that we are really going to go and reap benefits of being a so-called research economy.
Thanks, Vishal. And I was looking at the clock. It's exactly little past 5. So Mr. Santosh Mishra is coming to the kind of end of his time limit. So quickly, whatever few minutes you have, Mr. Mishra, please.
I'll take 5 minutes to close, and then I'll leave. Yeah. So I think very valid points. I think Mr. Bali, is it Dr. Bali or is it Mr. Bali?
It's Mr. Yeah.
It's Mr. Bali.
I'm a compounder. I've just been in healthcare for 30 years, working with the likes of Dr. Ajay Kumar and others.
Right. So thank you. So I think very pertinent points, and I think you have again said the right things in the sense that China is almost now snapping at the heels of US in terms of cutting edge technology, whether it is, I don't know again on medical so much, but I keep following the technology world. They are almost just there. I mean, it's just maybe a notch below and nothing more than that. China produces a whole spectrum of papers. So you have a large percentage of it is not so great, but there is a good percentage of those papers are really great papers. I mean, some of the cutting edge research in cryptography on in VLSI design is actually coming out of there. So of course they had their own strategy of building, and I think whether we will be able to follow that or not is a different topic. But I think coming back to what you said, one of the points you did mention was very important. As I was mentioning, that there's a misalignment of objective in research and for social for creating products for social good. The other thing is that, and again, particularly I've seen this in management in other technologies. There's a huge thrust on theory building, and I think theory building might be a very great idea, but I think if you look at it from society's perspective, theory building is probably secondary to actual good outcomes for the society. So I think that's another misalignment in the research and the practice which I see and notice. Whether government will be able to spend 4% or 5% of their GDP on research in India, I have my serious doubts. I don't think the fiscal situation actually has that space where you can actually that elbow room to allow you to expand 10 times in R&D. While it is an objective, probably they should aim towards that. But as I said, I think the mechanisms which have to be created may be required to sort of bootstrap themselves, think of innovative funding methodologies. If you don't have 6% to spend, you might as well invent ways to figure out how do I get that money from. And I think the government, and as you rightly said, I think it cannot be academia separately and the industry separately and the government separately. Maybe we can pull in together, create institutional mechanisms where there are ways to get funding for research, and possibly not as frustrating as Dr. Ajay Kumar was saying, something which works well. And I think you asked about whether we are moving in that direction. I've been seeing I've been in the government for 20 years. I can tell you this, it may not be so visible from outside, but there's a huge churn within the government to actually address some of these issues. So, the rankings of institutions, research institutions, universities, colleges, ease of doing business rankings, this all is a big movement. And in fact, I don't know if you have been following, ease of doing business actually has been now translated into a great fiscal incentive for the states as well. So it's not mere slogan or something which makes you look good, but actually it enables you a great incentive on the fiscal side if you can actually get your ease of doing business ranking up. So Startup India, whether it is ease of doing business, whether it is national institutional ranking framework, all that, to my mind, is actually propelling us towards that direction where innovation is to be valued. One of the reasons, if you were talking about patents, and I think one of the key reasons why we don't have so many patents, of course, we were late entrant. The patent regime is so expensive. I mean, if you try to patent anything abroad, you will realize how much money it needs. And even within India, it's not really so cost effective to actually patent. So I think we need to figure out, again, it's a big challenge. Also, you have to look at, there's a huge tendency, and I noticed particularly in the Western countries, and there are a lot of frivolous patents also. So these are like, and patents are interesting interesting creatures. I mean, they are not necessarily to give you a commercial advantage. They are more like a protection wall around you. So so you actually create set of patents so that and then when you are powerful enough, you can keep violating somebody else's patent and they can keep violating your patents, and you kind of live with that, but you don't allow somebody else, smaller one guy, to come up. I mean, so there is a whole politics of patents which goes around. So I think we need to be aware of it. Nonetheless, it's not to detract from the statement you made that we are abysmally low in the patent percentage. I think we need to focus on that. And as I said, I think the patents, it cannot be a concentrated patent program, if you will, because as I said, I mean, the fiscal space available to the government, whether it is state or center, it may not be so comfortable that you start doing and delivering on all your desirable objectives. But what can happen, I mean, some sort of bootstrapping, you allow, as I said, NIRF. I mean, how does NIRF contribute to patent increase? Because if you add that as a component in NIRF ranking, how many patents a university has, or how many startups? Google came out of Stanford. How many startups you have come out of your university? If it becomes so, those things will kind of fold back into the concerns you were raising in terms of innovation, in terms of startup, in terms of patents, in terms of research spend. A very interesting anecdote I will share, and then I'll close. One of my professors, and this is long time ago, so it has no relevance to, this is when I was a BTech student. So we are talking at least 30 years earlier, almost 30 years ago. So one of my professors designed a very power efficient induction furnace. So that was like, it saves about 30% of the power which an induction furnace typically uses. Induction furnaces are for melting of scrap material and all that. And I think there was a large segment of industry around which was using induction furnaces. So he invented this, and he was then, with his PhD student, was trying to sell this new technology to all these industry. And surprisingly, nobody was buying it. And he was like, 30% saving means you will recover the cost in less than 1 year. I mean, 8 months or 9 months, you recover the cost, and then rest is saving to you. And then when nobody bought it, then he started digging around. Then they found all of those guys were stealing electricity and using it. Therefore, they had no incentive to actually put a more sophisticated technology. So this is not correct. This is 30 years ago. But nonetheless, it shows that how what we were talking about ecosystem, you need to have an ecosystem which also protects patents, which protects innovations, which gives legitimate incentives to the innovators. And I think Startup India or Ease of Doing Business or NIRF ranking are the right step in that direction. Hopefully, in the coming years, we should see some of this. And I think another big silver lining which is there is the emergence of AI. And luckily, that's like, while it has its own set of challenges, it's also democratization of a lot of things which you could otherwise not do. So it enables in oncology, in glaucoma detection, in all kinds of stuff where you needed very, very sophisticated equipments to do something. Now, I think a piece of software can actually assist you in doing that. And I always believe in human in the loop use of AI, particularly in the medical field. I think it can be a great assistive device to cut down the cost and actually help you, give you an edge in research also, and in coming up with new solutions. So with that, I'll like to leave. It's late, and it was a pleasure talking to both of you. Kindly do share with me your contact details. I'll request Sanjeev ji to kindly share my details with them and their details with me, and would love to be in touch. Thank you, and it was a pleasure for me to have been here. Thank you so much.
Thank you, Mr. Mishra. Given your tight schedule, you still managed to be here. Thank you so much once again. And we will remain connected. Yeah. Okay. Thank you so much. So going forward, I think Mr. Mishra left us on a very important note. And while this session is kind of, supposedly at a higher level and not go into specific technologies, but and how those technologies are moving across the continuum from research to on ground. But I think AI is something really which is very close to all of us and which seems to be a game changer going forward. And we are lucky to have Dr. Sujay Kar, so who has actually spent a lot of time and is actually driving the AI initiative within the group of Apollo hospitals. So I would take this opportunity to ask Dr. Sujay Kumar, he should say whatever he wants to say. In addition, if he can take this thread on of AI from Mr. Mishra and can focus a little more on that and see what's happening to that technology from end to end. Dr. Sujay?
Thank you, Mr. First of all, I have a technology challenge. You will not be able to see me.
Okay, all right.
That's my disclaimer statement to begin with.
Okay.
I think we had a very interesting discussion. And I think if you are bringing in the analogy of cricket, I think everybody is bowling here and I will try to bat.
Okay.
I want to start with a very optimistic note here. That despite challenges that we have had classically about, papers not coming from India, research not having published, the kind of things that have happened in past, we have not been able to give enough resources to or funding to our scientists or our professors at the academic institutions to deliver, or whatever was given had not given the kind of results that probably other institutions or like my alma mater at MIT would have got. I think these are, I take this criticism with a pinch of salt. And I will start with a criticism. It is talked about a couple of days back. I was in a panel with the scientists at MIT, and we were talking about that AI did not deliver much to avert the COVID crisis. But we understand the fundamental challenges that the technology faces. AI's potential application covering medical and societal changes created by the pandemic are maturing to show operational impact. We would have to give time to any technology to mature over a period of time to actually show their operational impact. And that is where there are things that are happening on a molecular perspective, which is like helping in drug repurposing and discovery, which is happening in clinical perspective using of the data and the image to predict patient outcomes, to take optimum next steps. We built some of the models here within an Apollo hospital, and it's been working pretty well and been used prospectively. And then, of course, the societal aspect, the epidemiological research modeling and associated infodemic to address the misinformation that is going around that. But at the end of it, it is all about how we share data and how we capture data. And that has been the fundamental challenge that Indian healthcare has faced so far. People have not actually paid attention in the way that they would collect electronically fair and appropriate data for further use. So I don't want to go into other realms of science. I don't want to go into the other scientific areas. I want to stick to healthcare and tell me, how are we collecting the data on the last mile in the public, primary healthcare systems? Is there a way by which we have been able to do that? And that is where we would have to go back and go to the drawing board, look at the recent document that has been published by Government of India, came out in the August 15th by Prime Minister himself, the National Digital Health Mission, and what it talks about, and what it does to lay a foundation to collect the data appropriately. Because if you do not have the appropriate data, you probably will not be able to do a proper scientific research. My friends, my colleagues, professors at IIT Kharagpur or at IIM Calcutta are, and I've been teaching there for 5 years in both these institutions. They have been talking about it persistently, that we do not get appropriate data to actually work on. Look at the scenario very much from the Massachusetts General Hospital and MIT, which is just across the river. And the way that they share their data together to build models, to build technology, and come back with that. So that is fundamentally what we have to look at in actually looking into collecting appropriate data, using data collaboratives, which I'm sure my friend Mr. Prashant will share in that. Now, coming to the whole shaping of the healthcare with the technologies like AI and all of that, and I'm little perturbed with the kind of things that we have been talking about, research that does not, the rubber does not hit the road. What are the startups doing? There are enormous, anybody who is working on a startup today would be a little disappointed with today's talk, because there is so much of faith, there's so much of promise that the startups hold to actually change the dimensions in Indian perspective. And we must give them that kind of weightage at this point of time. But there are fundamental challenges, or suitability challenges, as I call them, to actually do this kind of research and find a way into that. And I have voiced it as a part of I'm a member for ICMR, CDIOD, and other boards. First thing is to identify what clinical or public health problem are you going to solve. Is it pertinent? Is it important? Will it give you an appropriate last mile usage of that particular thing? Second, collect it appropriately, identify biasness in your system, and try to negate it as much as you can do in terms of research. The third thing is it has to be practically accurate, practically something which would have knowledge representation, something which will have clausal structure, something which would talk about flow of information in actually giving that. And fourth, which of course Mr. Mishra just said a few minutes back about the human in the loop perspective, where we need to learn the algorithms. We need to learn when to take over from the algorithm, and algorithms need to learn how they are going to take over from us. And that symbiosis will help in all the 9 parts that we look for to actually implement and commercially make viable projects in healthcare or in healthcare AI. With this, I will stop because I started talking about data collaboratives, and I want my friend, Mr. Prashant, to take over from there and talk about the importance of the use of these data collaboratives, which are beyond geographical entity, to actually build this kind of models, validate them, and to see how useful they can become in healthcare perspective.
Yes, Mr. Prashant, please go ahead. Thank you, Dr. Sujay.
Mr. Prashant, you have to unmute yourself.
Can you hear me now? Okay. So thank you, Dr. Sujoy, for setting the context. And what I would like to do is to, the question that Sanjeev posed, right, in terms of conversion, I want to actually bring 3 dimensions to this, right? And then, in there, I can talk about some of the technology trends that we see, the notion of collaborative that you mentioned, and so forth. So in the first dimension, the way we see this is how multi-party collaboration, right, can really contribute to reduce the burden of chronic disease. And we believe that multi-party collaboratives are a critical enabler for the health industry to convene various stakeholders and expand data partnerships with other industries as well. The other important thing is that these collaboratives actually establish a shared purpose of building the next set of intelligence to help reduce burden, operational efficiencies within local markets, and enable new cross-border opportunities, right? And I think Dr. Sujoy brought in a very important point in that dimension, that it also drives unique developments that will pave way to new dimensions in clinical efficacy while establishing feedback loops from the first mile, right? And our work, Microsoft's collaborative efforts across cardiology, eye care, and pathology. We had collaborations with, Apollo Hospital in the context of it. last year. And also, these are concrete steps in this direction. We believe that this is one very important dimension of bringing closer to that conversion of research into success. The second dimension I want to touch upon here is the tech velocity. Okay, so this is about with an exponential growth in the amount of data that is being generated across the world. There is an increasing recognition that this data should play a critical role in solving some of the most difficult public health problems. And the data collaboratives actually make use of public-private partnerships, innovation capabilities, disparate data, and our increased ability to analyze data sets, including unlimited compute capacity, right? Like, so, think about Azure as a world's computer. And we can actually now have an unlimited compute capacity to analyze these data sets. And this generates public value and solves some of the society's greatest health challenges, right? So think about, from our side, we have integrated the FHIR interoperable standard as a first-class data type in our cloud in Azure. And to further facilitate these collaboratives that I'm talking about in the first dimension, right? We now have technologies to enable low friction data sharing within these boundaries defined by the partners. And we believe, and this is something that we actually actively deployed during the COVID-19 pandemic and before as well, and which fosters a very powerful network effect realized by combining efforts across these industries with unique capabilities and so forth. And the other important thing I just want to mention in this dimension is that this could support marketplaces and collaborative workspaces that combine assets from various stakeholders in, for example, National Digital Health Mission, where we can also bring confidential computing to shape up how collaborations can be done in the future, right? So that's another way. This tech velocity is another way to actually increase the conversion in the context of research to the reality, which is the topic of the day. And then the last dimension I want to talk about is this conversion principles and policies. Here, there are basically two things I just want to touch upon. One is responsible AI, right? And these are the principles that we must follow in developing last mile impact. Fairness, the systems should treat all fairly. We should perform reliably and safely. The system is secure and respect privacy. Should empower everyone and engage people. Should be understandable. Transparency is there, and then she is also accountable. If the actions of the AI systems are not correct, right? We need to fix it. We need to get that feedback, and actually follow these AI responsible. Right? And as teach to students and work with startups, accelerators. This is the 6 principles to which you can actually improve conversion, to bring this multi-party AI in research to the last mile impact, right? If you actually really do great job in these 6 places. And then the last point I want to make here is that to make something into a market success, there are really 2 hops, right? In past 20 years, I've worked on Razor Mobile and Azure Cloud, right? These are some big plus businesses and so forth. And couple of things we learned from doing this work, right? The first aspect is but, right? When you talk about the first hop in market success, it is about translating research ideas into product. And from product management upskilling for Indian context, one of the ideas that we have been talking to Meiti and in fact many other researchers is that we need to induce design and market thinking blend into technology mindset, right? So from policy perspective, it is about blended courses in undergrad and graduate degrees around this design, market, and technology, or even government funding cross-university hackathons to blend these disciplines, right? And then once you have the first hop done, which is the birth hop, right? The second hop is about scale, that you have a product and how do you convert into a market success and a business success. And in that context, one of the recommendation I'll have here, right, for improving that conversion would be local regional ecosystems to build solutions and distribution networks to address regional demand. So many times we always think that global apps is an answer for every problem, but that's not true. We have to actually, create these local marketplaces of all these applications, digital apps, building the local solutions for local problems and distribution networks. And then once you prosper into your local networks, you can actually go to other regional networks to become, to scale up and to become successful. But the reason we say about this local regional ecosystems is the fact that you can now really become successful rather than just waiting for the entire world to adopt your work and then you don't go anywhere. And then the last point I want to make here is that, to improve this conversion from research to reality, we have to actually introduce this notion, and this is something that I was presenting to a few set of ministers a year back, which is keep it simple, right? The usability trumps functionality. And at the end of it, it's not just about adding very complex, set of features and functionalities into this structures, but make it as simple and let it thrive, right? And those are the things that can improve conversion. So in totality, these three dimensions of construct of data collaboratives, tech velocity, and conversion principles and policy, right, can, I think, really make a difference here. Over to you, Mr. Sanjeev.
Thank you, Mr. Prashant, for giving it a totally different spin, and thank you so much. But coming back, I would like to go back to Dr. Ajay Kumar. Sir, you are still there?
I'm here, Sanjeev.
Okay, so now having heard all the stakeholders, what is your take now? Do you feel differently, or do you feel optimistic, still pessimistic? What is it now?
See, Sanjeev, we have heard from bureaucracy, we have heard, and we have heard from Vishal very well on the funding and the percentage of research we do, pathetic. And the ecosystem is very important. And we heard from two of the, Sanjay and Prashant on the IT part of it. It's great. Ideas are great. Views are good. And we have the mental capacity, IQ capacity to push it. We have proven it that we can. But fundamentally, it all boils down to, ecosystem. There are 3 or 4 things which is needed. Like even if you look at oncology, the data we have worked on data. We have created 200,000 patient data base where we have curated 50,000 already to look at the causes of recurrence of the disease. What is the genomic? We work strands. We are about owner, and with 42 PhDs working on the genomic cause of it. Amazing data. For example, in head and neck, of genomic we call as mutations we are finding on 100 patients we did, there is nowhere reported in the world. Nobody has reported this kind of genomics exists, mutations. We are just scratching the surface now. Amazing work we can do. But one important thing, we heard, we hear from GE, we heard from Siemens, IBM. They all are got shops in India. My use Teams, Microsoft. But how many of these, even pharma, how many of them are getting profits out of India? Giving some of their profits back to the local community of India. In my view, not much, or maybe near zero. Their profits are flowed back in US to the major centers, universities. They fund beta sites. I have a clause. I will not buy any of your equipment until we have a working partner. Why should Francisco or university partner? Why not equipment? Why not to do research? Not. Tell me, worst offender. Nothing happens because there are some rules, regulations. They don't fund. So all I'm saying is this kind of funding, which is major in the Pfizer's of the GE, Siemens are the ones funding. The Germany, you look at Iran, entire city is funded. Entire city. The profit back to the community. Where is the profit coming, man, here? which are in India are not going back. If you talk to them, pharma companies quarter to quarter. I mean, them are doing research. Shops, major technology companies are body shops. They are not doing research. We are back-end workers for the people in cities telling us what to do. So unless we detach ourselves, based on, I am convinced everything, there is one person who know all. More realize how little we know and how little we scratch the surface, Sanjeev, on this research to reality. Enormous opportunity is being squandered because of various reasons, disagreements, bureaucracy. I know the best, you know the best. But we don't have a team effort. The team is the ecosystem, which could be funding, it could be intellectuals meeting here, together brainstorming, it could be government saying, I'm here to open the doors for you, helping hand. We don't need money from government today, really, we don't. They just need to help us in the facilitators, they make it happen. So that unless that happens, we will be eternally slaves to the West. Eternally, the Microsofts and Siemens are the ones who are going to come and tell us what to do. But AI, imagine AI, Vinod Khosla stood on a podium with me and said, Doctor, I'll run you out of business 10 years ago because I will tell you who has got cancer just by their breath. What has happened? Even the entire pathology, AI has not happened. It is not that simple. Human body is the best computer you can get, Sanjeev. When you look at gene editing, why it is not? Because what I want to say is, we are just scratching the surface. Gene editing. When you go and edit a gene, CRISPR technology. I went to the lab. I studied CRISPR technology. Okay, if you have a disease at birth, I can change. But what happens when that changes? Some other gene undergoes an alteration. So you will develop some other disease. Something else will go wrong with the person. Do we know that? That is something we are realizing. Even in cancer treatment, when they treat a gene-specific trait, what is the amazing thing? The cancer cells develop another gene which is resistant to that treatment. So I have to find another treatment for that. It is. As we learn more, like Socrates said, if you want to be a wise man, you have to realize how little you know as you grow into this. Honestly, we know very little. If somebody says, I know the answer and all, certainly that person is not wise. I can tell you that much. So we need to learn and learn and learn. I am 69, Sanjeev. I learn every day. 45 years in oncology. I feel I don't know really oncology. Every patient I learn. Why a patient should recur when they're not supposed to? Why a patient does well when they're not supposed to do well? It is an enigma. It is something we don't have answers. So I think the technology, the genomic treatment, everything has to be put together to learn answers, and it is rapidly spreading. Every 75 days, oncology is changing. So we need to really a team effort, look at funding, look at bureaucracy, break the barriers, and all of us have to come together to create data and curate the data properly. Curating is the key. Curate the data, go deep. It is not the volume, it's the depth of each data, and see what we can learn from it so we can advance in the medical. And India is a great opportunity. We can leapfrog. We can learn from others' mistake and leapfrog. With that, I will leave the conversation. Thank you.
Thank you so much, Dr. Ajay. But on a lighter note, you did bring up this quarter to quarter reference a couple of times during your talk. After having listed HCG, aren't you become a quarter to quarter man or no?
No, I have refused. That is why somewhat we have suffered. I have suffered because of that. When my stock went down to 65, people started calling me crazy. I said, I have other stakeholders. My patients are my stakeholders too, not my shareholders only. Anyway, we have overcome that. But what I want to say is, you have to do that, but you cannot be your shareholders are not the stakeholders. They are one of the stakeholders. But your stakeholders are your employees, patients. You are very patient-centric. That is very important to understand. And research should be part of it.
Sure. So Vishal, for you, last word.
Yeah, so I think this has been a very interesting conversation, Sanjeev, and great comments from all the fellow panelists. To rewind, the reason why we said research to reality, and going back to the conversation that we did the other day, until and unless research translates into reality, we are all living in a bubble, right? And in a bubble, you can have multiple conversations without reaching any end goal. So I think if we have to really, the next decade, if India has to, be the nation, particularly on the healthcare side, on the medical technology side, if we have to aspire to be where we want to go, given the fact that today 95% of our technology, of our medical technology, of our pharmaceutical, real hardcore innovative technology comes from outside of this country, and if we have to really become self-reliant in more ways than one, then all the research that goes in today will turn into reality in the next half a decade. If we don't start now, then a decade from now, I think we'll be having the same conversation, that research happens in the West and India consumes it, and India then produces a whole bunch of other technologies and makes a little bit of changes and just produces. And we will be just a consumer of generic drugs and generic technologies, which have all gone off patent. And I don't really think that that's the right opportunity for this country. So we definitely need to accelerate our research thought process and make it into realistic outcome.
Thank you so much, Vishal, and thank you, everybody. I think we already overshot the timing of 5:30, but I will personally make sure that I'm individually connected with you all. I will make sure all of you are connected together, and we'll follow this thread which has been started by this meeting. And let's make sure that some changes happen, however small, in the positive direction in times to come. Thank you so much once again, everybody. Bye bye. Good
Thanks,
evening. Good night.
Thank you, CII. Bye bye.
Sanjeev.
Bye bye.
Thank you all
Thank
the
you, CII.
panelists for joining us. Thank you.